的马来有族同胞说声开斋节快乐 Selamat Hari Raya。 那我是你们今晚的司仪 Delis， 我来自马来西亚罗佛古来。那线上有没有和我来自同一个地区的朋友？你可以在聊天室和我打个招呼吗？ Hello， 嗨。其他的朋友，你也可以在聊天室告诉我们你来自哪个地方、哪个地区、哪个国家，好不好？是的，哇 ，Hello， 我看到有来自我们吉隆坡的朋友，你们好；还有我们新加坡古晋的朋友，你们好；还有我们在印尼的朋友 ，Hello， apa khabar？那非常非常开心，也很感恩你们的热烈回应。那其实真的今晚呢，我看到好多来自各个地区、各个不同国家的朋友都一起聚集在这里，在这个分享会。那想必大家都知道，也一定想要拥有一个健康的身体，对不对？那就让我们一起来度过今晚这个美丽的周五夜晚，好不好？那我相信在刚刚结束多天的假期，也和你们的家人度过一个充实开心的假期的你们，刚刚回到工作岗位上，那你们在百忙之中抽空来出席我们今晚的分享会，一定也是因为你们深深的知道代谢健康的重要性，也知道一个健康的身体对我们有多重要，对吗？那的确，现代都市人的生活大多数都节奏非常紧凑，那这样子的一个忙碌生活节奏呢，也的确让我们的生活作息不规律。那一般上呢，我们也很难取得均衡的营养，同意吗？那以上两个原因呢，就让我们呢时常呢一不小心，其实就会身体出现大大小小的毛病。那久而久之呢，这个慢性疾病似乎也会悄悄找上我们，所以这也是为什么我们今晚会一起出席这个分享会。那今晚就由他来为我们分享，是最适合不过的。相信大家今晚一定会有所收获。在还没和如新公司合作之前，他曾在马来西亚沙劳越中央医院任职，任职期间更在多个部门提供专业服务及宝贵的意见，当中包括内科、骨科及妇产科。毕业于马来西亚国立大学医学系的他，秉持着一颗热心助人的心，始终坚信预防胜于治疗的理念，而让他一直热衷于健康保健的解决方案超过10年之久。那接下来就由他来为我们揭开健康代谢的秘密。欢迎我们的 Dr. Joe 钟玉峰医生，欢迎。
嗨，大家晚上好，所有线上的新朋友和老朋友们，大家晚上好我相信你应该听得到我的声音，对不对？那非常开心今天晚上有这机会呢，能够在线上和大家一起聊健康，然后我们可以一起呢去活得更加有活力，我们一起活得更加健康、更加年轻，好不好？如果好的话你可以在那个 chatbox 里面真的也可以回应我，好不好 ？OK， 那我是 Joe， 我来自古晋，那之前我在沙劳越的中央医院就职那当然今天晚上呢，我不是来跟他说我是怎么成为医生那我今天晚上呢是希望说通过今天晚上这样的一个时间呢，能够跟他分享一些关于一些健康的秘密，好不好？尤其是代谢健康这样的一个话题OK， 好那当然我相信很多人当一听到代谢健康这个词呢，我相信有很多人可能第一个想法是什么有没有人要猜一下第一个想法是什么 ？OK 可能我知道有些人可能的第一个想法就是我们讲说可能就是想到瘦身了，有没有？可能就是想到要第一个想法就是想要瘦身，或者说第一个想法就是想要苗条，或者说很多人想要就是代谢这个词呢，可能就像是我们讲说想要多运动，对吗？那可能今天晚上呢，可能我想要跟大家分享一下可能更比较深入一点点什么是代谢，好不好 ？OK， 什么是代谢健康什么是我们的代谢系统 ？OK， 来我教一个 OK 好，那当然什么其实代谢健康这个词呢可能我相信很多人都听过，对不对？可是你知不知道其实新陈代谢它指的是我们身体的整个体内的很多的一连串非常非常复杂的一个化学反应 其实它包括你的食物跟你能量间的一个转换，组织建构和能量储存，还有细胞废除清这等等等等很多的一些化学反应那其实我今天晚上呢，我也特地去找了这个图给大家那其实我不知道有谁看过这个图。我相信如果你有看过这个图的朋友呢，可能你应该也是读 bio 的就是我们的biology 的然后我相信这个图呢，可能跟我一样其实也是一个给你一个非常非常大的一个就是噩梦的一个图为什么呢？因为其实这个 metabolic pathway 我们在医学上我们称它为 metabolic pathway 这个代谢的整个系统呢，它是非常非常复杂的一个系统，所以它其实包含的不只是不只是让你瘦身，不只是让你减体重而已，其实它包含了非常非常多。
It's very very complex. It consists of many things. So, yeah, you can see there. It has glycolysia and Krebs cycle, urea cycle, and so on, right? So every term in this diagram is a chemical process. Okay, so when I was studying my medical course in the university, I saw this diagram. Wow, I really feel my head spin. So, and when I look at this again these few days, wow, again my head spin and I can't even remember some of this term. Okay, so a lot of memories flow back into my mind. But anyway, what is a metabolism and what is metabolic health? Right? Like for example, blood sugar, cholesterol, insulin, these are all some indicator of our metabolic health. Right? So, like for example, we talk about your blood sugar level high, you think you have diabetes, then your triglyceride level high, you think you have fatty liver and so on, right? But these are all some indicator. Okay, so when all your indicator are above a certain level, then it is sending a signal to us that warn us that our metabolic health is being compromised. Okay. So I always say that metabolism is not only about obesity, right? It's about the process of turning nutrient, right, into something that your body can absorb, strengthening your body, growing muscle, including remove toxin waste from your body, all this. So actually it not only affect obesity, it actually cause you to have like your fat tummy, constipation, blood sugar instability, sleep disorder, and so on and so forth. So when it is more serious, it will cause metabolic syndrome. Okay, so what is metabolic syndrome? So actually when you have all these indicators, for example, high blood pressure, high blood glucose, fatty liver, heart disease, or other major diseases, dementia, polycystic ovary syndrome, and so on, all these are probably or maybe
metabolic syndrome
are part of the all these are actually part of the metabolic syndrome. Okay, so when through the studies and also data that we have, right, when you have a metabolic syndrome, right, your chances of having all these illnesses are above, right? The chances of you having all these diseases are higher than the normal people. For example, right? For example, your risk of diabetes is 6 times of normal people. Right? Risk of hypertension is 4 times, and hyperlipidemia, which is basically high blood, this is also 3 times, right? And then cardiovascular diseases and stroke is 2 times, right? Yeah. So if you look at it, right, to simply put it, right, metabolism, right, or metabolic health, right, covering your whole body, okay? So in the last 2 years, because of COVID, right, COVID impacted a lot of people. So actually, based on a study in England, when our weight increased, okay, it actually increases the rate, right? The probability of these people, these obese people are being hospitalized. Yeah. So you can look at the chart there. Okay. So really, it clearly show that the probability increased so much for people who are highly obese. Then diagram on the right really show you that when you are an obese person, really you will be affected more badly by COVID-19, where it will cause severe diseases and really you have very poor clinical outcome. Yeah. So actually, do you know that many people tell me that if I'm slim, does it mean that my metabolic is healthy? Actually, not necessary. Maybe some of you, you may have friends who are very slim, but they tell you they have high blood pressure, or they have high blood sugar, or they have fatty liver problem or cholesterol problem, right? Yeah. So all the studies show that even people with normal weight, right? Yeah, 2/3 of them actually don't have a healthy metabolic. Okay, and there's also a study to show that only 1 in 8 people is actually metabolically healthy. Yeah, so which means so in every 8 people, 7 of them are not healthy metabolically speaking. Yeah, so all this will eventually lead to metabolic syndrome, which will eventually cause severe disease like diabetes, hypertension, heart disease, and so on. Yeah. So maybe some of you on the line here tonight, you feel very strange. How come all this problem related to metabolic is becoming more and more severe? Yeah, that's because today we live in a very modern life where we're always very busy. It's always chaotic, and we are really stressed out. We live in a very pressurized environment. Long hour of working, our sleep quality is very poor, and we don't eat well, right? So all this, you see, cause our metabolic health to be compromised. And I share with you this, okay? Yeah, you see the data, right? When you see the chances of getting diabetic when you have metabolic syndrome is higher, right? And the past 30 years data, meaning from year 2000 until 2030, forecast that the diabetic rate is projected to increase by 242%, yeah, globally. So you look at those data, it's very, very scary, right? In year 2000, we only have 151 million patients, right, of diabetic, and by 2030, this will become 366 million patients. Yeah. So, yeah, in Malaysia, we already have a very high percentage of our population with diabetic. Yeah. So this is something that we must really pay attention to. Yeah. So what is diabetic? Why? Why is it so important to understand? Yeah, and how we can prevent, take precaution and preventive measure. So, talking about diabetic, actually, a lot of people say it is a problem of sugar, right? Yeah, sugar. So once they know they have high blood sugar, they say, "Oh, I watch out my sugar intake." Yes, that will help. But do you know that when you are diabetic, maybe I give you an example. Just now dinner, you have your meals. Let's say you eat a plate of char kway teow or fried chicken. So this is what we call protein, carbohydrate, and so on, right? Or you just take a bowl of rice, right? When all this food reach your gut system, right? The process, the digestion process will break down and turn them in the carbohydrate into glucose, right? And so when this glucose go into your bloodstream, your blood sugar will shoot up, right? Yeah. So a lot of people will think that like that, right? But actually our body mechanism, right, is very complex, right? Just take blood sugar for example, right? If your metabolic is healthy, right? Your metabolism is healthy, right? It can control your blood sugar to be between 4 to 6, right? Because why 4 to 6? Because it's below 4, you don't have enough blood sugar, right? You feel like dizzy and so on. But above 6, you also, your body will not allow it to be above 6, because above 6, you may not feel anything. Maybe some of you on the line here, you have high blood sugar problem, right? You go to blood test, right? You found it's like more than 10 or 20, but you feel nothing, right? Strange, right? Yeah. But you know, when your blood sugar is above 6, right, you really don't feel anything, right? That's why we call it a silent killer, right? Because when it is high, you don't feel it, right? But if it is consistently so high, right, 24 hours so high, right, it's actually damaging your blood vessel, right? 24 hours damaging your blood vessel, right? And then some of them, like for example, it damage your blood vessel in your eyes, then it cause eyesight problem, right? Glaucoma and so on, or even blindness, right? Yeah, or kidney problem, right? You have to go and do dialysis, right? Yeah. See, most of our dialysis patients are because of diabetic. Okay. Yeah. So when your blood sugar is high, you don't feel anything strange, but it's actually damaging your blood vessel all the time. So our body mechanism is very unique. It control the blood sugar to be between 4 to 6, right? But really, what really cause high blood sugar is actually insulin. Right? Yeah. Just now I say, right, you have a bowl of rice, your blood sugar shoot up, right? Then yeah, because the glucose is being absorbed into the blood, right? So when this glucose is absorbed into your blood, right, it stay in the bloodstream. How could the blood is only a transporter to bring this glucose to all over our body, to our muscle, to our organ, and so on and so forth. But how do we ensure this glucose get into the cell of every part of our body so that it can be used, right? Or if it's a waste, it can be disposed of, right? Right. So, you know, whether it's fat tissue, fat cell, muscle cell, they need this insulin as a key to open the door, right? So when you have insulin to open as a key to open the door, then only the glucose can be absorbed into the cell, right? So yeah, so even if when your insulin is or this your body have this insulin resistant, right? That we commonly call insulin resistant. So which means your body don't respond to it, yeah, and therefore the glucose is not being absorbed into your cell. So when you realize that your blood sugar is very very high, right? Then you eventually have to take medicine, take drugs to control it, right? But eventually you have to inject insulin to help you to bring down your blood sugar level, right?
Type 2 的 diabetes.
So that is what we call type 2 diabetic, right? Type 2 diabetes, right? Now, so this is one of the metabolic syndrome that is commonly seen. Next, then we ask, how do we build a more resilient body, a healthier body, right? So our modern lifestyle really stress out our bodies, right? It really damage our metabolic health. All the process is being compromised. So now let me ask you, you type your answer in the chat box, right? So now question 1, which one would you choose? 1 or 2? 1 is sleep at 10 p.m. or number 2 is stay up the whole night, play your phone. It's gonna be honest, yeah? Put in the chat group, what would you choose? Be honest. Yeah. Okay. So you must reply the reality, yeah? Reality. Yeah. Okay. Number 2, you choose to exercise in the park for 40 minutes or you choose to play games at home for the one whole day. And thirdly, you will choose to take unlimited amount of fast food or you're going to take an unlimited amount of protein and vegetable. Yeah. I know you already know your answer, right? Yeah. Okay. Actually, why I ask you to choose is because it's very important here. Actually, we say, right, metabolic health is a spectrum, okay? It's actually a spectrum. So traditionally, we always say, oh, you have high blood sugar, oh, you have high blood sugar, you have high cholesterol and so on, oh, you must take medicine and so on. You have to take medicine forever, for life. Yeah, because this problem will be with you for life. Yeah, but when more and more research
代谢健康的时候，
being done,
其实我们发现到，其实它是一个，
on this
它其实
subject
它是一个
on metabolic
一
health.
个范围 ，OK， 基本上简单来讲呢，
So
其
it's
实
actually a
你的每一
spectrum.
天
Yeah.
的
So what does it mean? To put it simply, right?
生活习惯，它能够把你的健康
Your
这个机
lifestyle
制呢，它是可以
Your
把它
lifestyle can push your metabolic health to the lowest end, or can push it to the highest best position, right? For example, you eat something oily, right? And your body cannot really absorb oil, right? So your body so you know, you now let me ask you, you want your body to be able to digest fat easily or not? I'm sure you want, right? Yeah.
比较不容易代谢掉。
How could you then let your body in a position that could digest fat easily, right? So what it means is, if from today you choose a right healthy lifestyle, right? Like what? You regularly exercise, you maintain a healthy weight, you eat healthy diet, right? Then you have enough sleep, then you have enough fruits and vegetable intake, you lower your stress and you don't smoke. All this healthy lifestyle, right, will eventually daily, push your metabolic health to the good side of it, right? To put it into a tip-top condition, right? Slowly, day by day, right? But I know in the last few days has been holiday, right? Yeah, everybody go traveling, and or our Muslim friends maybe celebrate Hari Raya, and so I believe, I'm also a food lover. I'm sure all of you also eat a lot, right? Yeah, rendang and so on, right? Satay, all this nice food, right? Yeah. So a lot of people will say, oh God, wow, I eat too much, right?
身体的这个 spectrum 哦，
Just that meal will push
可是我们
your
我跟你讲哦，
metabolic health lower, right? But most importantly is not one meal, but every day of your last couple of months. Yeah, is it being healthy, right? Your lifestyle in your last 30 days, 60 days, right? So are you adding point to your metabolic health or deducting points? So really, we through changing to our lifestyle, we could actually control and adjust our metabolic health to a better side of the spectrum. Okay, so that's why I asked you just now to make choices, right, of your lifestyle. So if you want a healthy body, you really have to maintain it. You really have to make sure your lifestyle, including your pressure, your food, your sleep, everything you do right to help, because all these things accumulated and contribute to the outcome. So when all these work together, your body will become healthier and healthier. Okay, yeah. So
okay, over the last 7 years, when all this about research and development, so actually really in the 7 years that a lot of scientists already start doing this. They know that they do a lot of R&D and talk about the anthocyanin. And why is that so? Because there are also a lot of our study also show that you can actually, you want really in-depth one, you can go in there. I want to talk about this. So it's here, well, Pharmanex scientists in the last many years, they are all already in the deeply, research, and they come up with the, look for the best anthocyanin and best supplement to actually focus on the metabolic and especially our gut health. We call this anthocyanin, right? And through this 7 years of research, they know that other than the anthocyanin can help on the gut health, it can also find out that it can also help on the entire metabolic health. So when the scientists go deeper into the R&D, they find out that the anthocyanin actually produce a lot of benefits. So the number one, rather than other than the gut health, and through the all the good biotics, all the good what do you call it, the biotic in the gut will actually be increased. It make our gut health even much more better. At the same time, when our liver, the fat accumulation in liver can drastically come down, and also in our oxidative stress will also be down. So here one of the most important also our intestinal permeability is also will come down. And also here, also in our lipid in our body will also can be reduced. And most importantly, also the fat tissue can also be reduced, because when we absorb all the glucose, and when we eat a lot of carbohydrate, we can actually help us to burn out all this, before it turns into glucose, because we need a lot of muscle. And the more that when we build out our muscle, right, we need a lot of glucose, but we can actually burn out the glucose fast enough to in order not to turn into fat. So here, this is can also increase the insulin sensibility. In general, the entire situation is able to help us to actually live a better metabolically. So here, if you know about Pharmanex, right? Pharmanex actually they are very strict, they are very stringent in they actually have what they call it, a very stringent into the 6S quality. So here, this 6S I really admire and actually amazed with it. And also respect this entire process, because through the selection, sourcing, and also standardization, safety, and substantiation, this is whereby I really amazed the most. So here, this 6S quality control, it is through this process that they produce as AgeLoc reset to actually help us in our life. Why I say this? Because here, in the many countries itself, before it already go on the launch, and in Malaysia itself, it already obtained and achieved this gold award in ITEX 2021. It is in the medical and health category. What amazed me and actually impresses me that, to me, I received one information from KKM, the Ministry of Health Malaysia. They also officially sent this out in the official correspondence in the social media. They published this about the anthocyanin, because Malaysia KKM also encourage all the all the rakyat here to take a lot of purplish vegetable, because in this all these vegetable the anthocyanin is very, very high. So you see here, when in the English, it will help us to reduce the risk of cancer. Number 2, it can actually increase our immune system. Number 3 is to improve our memory. And this is really, really impressive, because our Pharmanex and New Skin scientists really are ahead of many competitors and in the industry, to know that anthocyanin is the most important thing for our metabolic health. And a lot of people will not know that what anthocyanin is. Anthocyanin is, there are many types. There are many types of anthocyanin in the market. So so the scientists also find out that in this difidin and cinadin and difidin, it is among the anthocyanin. This one has got the best and most effective anthocyanin in the among the anthocyanin family, because here they also discovered that through the blackcurrant, bilberry, and also black rice, through this ultimate choice of anthocyanin and a natural ingredient, they can actually extract the best of anthocyanin for our body. So this is whereby there are some research and also the clinical study that are already completed. So number 1 is it's all about our gut health, and it can be enhanced. So anthocyanin can help us to improve the entire overall gut health. So here, all the probiotic can be massively and improved. And here, it is this anthocyanin is actually food for our probiotic in our gut, and anthocyanin is their food. So here, when this food they get their food, the probiotic in the body can actually promote even a healthier microbiota and for better gut health. And here it says that the probiotic, the good bacteria in our body, which is the beneficial one, can actually increase by 150%. So this is where we say here, a lot of people, when we know after we take the reset, and then the stomach discomfort, whether you have sometimes you have a bad sensitive stomach, sometimes you constipate, sometimes you also cause a lot of discomfort in your tummy. After you consume our AgeLoc reset, they discover that their gut health has improved drastically. There are also some of my friends also told me, Dr. Joe, why am I, after I'm using the reset, why my stool is also in a bit on the dark color? It's actually in a dark purple color if you notice it correctly. There are friends asking me, and in the beginning, when my gut, when my stool, right, why is it a bowel all in and a number of times that I go to toilet has actually increased. I tell them it's very simple, because number 1, because our probiotic in our body has increased, it actually helps us to regulate the entire gut health and also the entire process of the gut movement. So number 2, the color. If you actually when you eat this dragon fruit, have you eaten that before? After you eaten the dragon fruit, do you notice that then the next day when you pass motion, do you see that all it become a red color? So you see after you take the reset, when the bowel become in a dark purple, it is actually very rich in the anthocyanin. That is where it causes the purple color. That's why we say that all these purplish color fruits, it is actually very, very useful to our gut. So don't worry about it. Don't worry, because this is natural. This is very, very normal. Okay, number 2. Now this is I really excited, because we are talking about stabilizing our blood sugar. And here, honestly speaking, when I see this, right, I'm very impressed and inspired, because you see in our you see all this statistic, right? All these clinical study, you find out that it can help us our insulin stability, and it help us to help our insulin resistance. So you see the slide on the first slide, right? You notice this is the glucose, and you see after 5 the number of hours, 1 to 5 hours, right? So you see in a normal person, after you taken a certain food or certain diet, if you are a healthy person, right, your metabolically is healthy, right, and normally, rationally, in 2 hours, right, your blood sugar will actually come, it will go up, it will escalate a bit, because you already take in some food that actually increase the blood sugar in your blood vessel. But if your mechanism in the body is healthy, in within 2 hours, it will become normalized and back to normal. And in 5 hours later, it will come back to about 4 to 6. Remember, you are less than 4 means you are less energy. It is you improve your health, but it is more than 6. It actually bad. It will cause a lot of damage to your blood vessel. So here it will actually cause a lot of cloggage to your blood vessel. So you see here you see this diagram here. This clinical studies show that after you take the sufficient anthocyanin, all these people, all this sample size can actually regulate their blood sugar very fast because the 4 to 6 level of blood sugar is where it is normal, and it also helps us to talk about the other one is our blood what do you call it normality in our blood. So here a lot of people also are afraid of this HbA1c. Why is that so? Because I just want to talk about a story here. Last time when I was working in the hospital, I know a lot of patients, they are very smart. Before they come to me, right, to do the blood test, right? So a day before, they are actually very careful on their diet. They do not want to give them their blood sugar high because they before a blood test, they behave, they cut their sugar, they control their diet. The next day they come to me on a fasting blood sugar is very healthy. Yeah, very, very perfect. But every time I see their HbA1c, right, I say you are not able to you are not able to lie on me, because this is talking about the last 3 months of sugar intake. So over the last 3 months, whether your blood sugar can be actually normalized and regulate or not, whether you are taking care of the diet, whether the medication helps or not. Right? Every time when I see this statistic, right, so I see this really. But it is after take this anthocyanin and AgeLoc reset, the HbA1c can actually be normalized, and it can be regulated in a very healthy level. I think this is really, really, really fantastic. Can make a lot of high blood sugar patients. It is a very good news to them, because here I got a lot of feeling in this. That's why this is whereby it excites me a lot. So here I know that this one can help a lot of people out there. So here, this is a bit of their testimonial that we a testimonial of our friends that already consumed AgeLoc Reset. You see the blood sugar, it actually from 15.3, it came down from 8.9, 9.8. It actually go back to normalized to about 5.6. And this is also our friends who actually tested it after 2 hours. They tested actually from 6.5. It actually came down to 4.5. That actually demonstrated that the insulin resistant and become much more healthy. And here a lot of people ask me, hey, why after I take reset I don't feel anything? Yeah, their friends also ask me. So yeah, I can tell you. So that's number one. That one reason is maybe your metabolic, you are healthy. You are 1 out of 8 person that who have good in metabolic. Okay, but maybe you are very lucky lah. You are one of the 8%. Congratulations, you maintain it very well. But when you are in a person who have high cholesterol or high blood, a lot of times, right, you do not have an ultra high, right? You don't feel anything. Unless you are at a very, very high dangerous level, you will feel something. You will feel some symptom. But normally, I tell you, when you are at a sugar level at a maybe 4 to 6, or maybe you are at the level of more than 6, you don't have any feel. So when you have 8 to when you are 8 and reduced to 6, you don't feel anything. So here in our metabolic health, right? So here, and also I give you an example, right? If our muscle can actually burn better, right? You will not feel a lot. So maybe you feel like you're much more energized. You can actually leverage on feel like you can recover faster, because you can actually turn the glucose into energy, or maybe your mechanism inside there can recover faster. When you remember that I'm talking about all this metabolic is involved overall a mechanism of our body. So if you think that in the short term you don't feel anything, but in the longer term, right, when your energy level is high, and when you have all this small little matter medical condition, in the longer term you can actually help you to become much more better. Number 3, it is we actually support the inflammatory balance. This is whereby, and also I look at it, I also excite me a lot. So here, this study also showed that it actually helped a lot of people. So here, a lot of people will tell us every now and then our body in an inflammatory condition. When body is inflamed, it actually causes a lot of damage to our body. And through this clinical study, after you take reset and also anthocyanin in our blood sugar, right, in a blood vessel, all this when we have something. When we consume other food that which is actually not beneficial to us, it actually creates a lot of toxin, and all this toxin will actually cause damage to our body. But here, and the anthocyanin can also help us to we call this maybe I see this I use this diagram to explain it better. You see our intestine, right? So here you look at this diagram. In between all our what do you call it in our intestine, right? You see all these small little tight junctions there. It is whereby it helps us to actually absorb all the nutrients inside. So you see all this good bacteria is to help us to absorb it. But here, if you let's say our all this wall, right, it is have got a lot of leakage. So you see the leakage in between, and all this endotoxin will go into our blood vessel. This endotoxin, it is a toxic. When all of this go into our body, and it causes the chronic inflammation, where it actually causes our body to be inflamed. And this is we call it a leaky gut syndrome. Okay, so maybe it will be not common to other people. So overall, if you look at it, when you do a scopy also, telescope also, you will not be able to see it. But however, if you have a leaky gut, you may be experience a lot of syndrome, like whether you have sensitive skin, maybe you're not able to digest properly. So when we talk about all this tight junction in between, right, it is have got a lot of leakage there. So here you will cause a lot of inflammatory in our body. Here I'm very amazed that all this anthocyanin can actually help us to tighten up all this tight junction and make every single what do you call it, the gap there has been closed down. So you won't have any gap there to cause the leaky gut. So this is whereby I have got a lot of and also this leaky gut will cause a lot of other syndrome, and it can cause us sinus, and cause us a skin problem. It can also cause about the constipation. It also cause the stomach sensitivity. It also cause the chronic pains in between our joint, and all this. A lot of research has shown that this is leaky gut will cause damage, a little bit of anxiety and depression in our brain, including the dementia. All this the what you call it, the damage caused by the leaky gut. So here, this is one of the testimonial. She also have this sensitive skin. So when you look at it, when he use his nail to scratch his skin, right, you can see the mark there. So you see, a lot of people will think that this is a skin problem. However, when you go deep to know, right, you go to the skin doctor, right, skin doctor will not be able to prescribe a good solution to him. Maybe some, prescribe him with some, cream and all those stuff to solve it temporarily, but it came back. And this is one of my friends. After she consumed the AgeLoc reset, and I'm very happy that we're able to help him to improve the skin sensitivity problem. You look at this, what do you call it, the short video. Last time she's able to actually write her name onto the skin, and the mark will still stay there. But she no longer suffer from that kind of problem, and the skin problem because of the leaky gut, right? So here, when your skin problem is caused by leaky gut, I can tell you, AgeLoc reset can actually solve your problem. And there will be people that are sensitivity, skin sensitivity is because caused by other matter. So there will be other matter. Okay, here. This is also another testimonial. You look at this, it's through the AgeLoc reset, I help them to solve their skin sensitivity problem. You look at this, and this is a lot of people talk about all this, the skin, skin peeling at their finger. Yeah. Number 4 is the liver health improvement, and this is talking about the fat in our liver. One diagram is talking about someone who is eating a lot of high caloric and also high fat diet person. So you see a lot of white spot into the liver scan. So you see what the white spot are all the fat. Number three is actually a healthy liver, which is a very little of the white spot. But in the between one, in between, you can see it's also very healthy. But this is a person who actually eat a lot of high calorie, high fat food. But at the same time, he took anthocyanin. When you look at it, the result, it is similar to a very healthy liver person. So meaning to say that it can actually, AgeLoc reset and anthocyanin can help on a healthy liver. So here, overall, AgeLoc reset and also anthocyanin, it actually shift our body to a more healthy metabolic state. And this one, I also want to, show this, explain this to everyone here. So you see here, you see number one diagram, we are talking about the, the first diagram is the person who is sedentary, who don't move a lot. In the right hand side is the person, and the middle one will be the person who have a very healthy metabolic, who have a very good and healthy lifestyle. Number 3 one is the one who consume the anthocyanin. You look at, this is talking about you look at their liver function, fat tissue, the muscle, and all this. And so you see the person that I highlighted in red, right? You see the difference between a person that the person who take anthocyanin regularly is actually similar to the person who have a healthy metabolic, healthy lifestyle. So this is the whereby we say that you can discover that you see the liver, that one of the liver in the lipid accumulation. Here you see. It can actually dissolve our the fat accumulation into a liver, because I like it so much, because I'm the person who actually from from young I'm actually I'm actually a bit over fat lah. So I know that this one can help me to reduce my fat in my body, and this is whereby I actually look forward and like it. And here you look at here the tissue, you see this FT synthesis. You see this is they are talking about the you see this is how we can actually dissolve our fat into a muscle. I listen to this. I really excited, because these are the one that we can actually dissolve in short that we are able to burn the fat quite easily lah. So here also there are also the other one that in the muscle column, you talk about insulin receptor. So I also like it, because AgeLoc reset can help to improve our insulin receptor, and also it also help us in the liver, also can help us to improve our entire overall metabolic condition. So you see this diagram, this short video. So here, this is we are talking about our glucose, right? So if the glucose want to come into our cell, right, it actually go through this channel. We call it a glucose channel. How this channel open, right? And if we need this insulin receptor to open up this door to accept the glucose. So you see here, very simple that the cell are the insulin resistant, and ignore this message. If we know that the anthocyanin can help us to improve the insulin receptor, there it can actually go into us, our body is much more at a much more easier state. So here, this another friend of mine, he tell me that he cannot control his diet. He tell me that I cannot control my food, because whenever I see food, I cannot resist. I just have to eat. So initially, I thought that he has got a psychological problem. But however, when we go deep to understand, he can actually go. He can actually, when we go in there and check his pulse rate, right? His pulse rate can go up to about 125. That is very, very bad. And with this high pulse rate, right, it actually caused him a very damage in the metabolic health. So here, after he consumed the AgeLoc reset, you see number one, the heart rate gone back to normal, become in the range of 35, 70-ish. So here he can now in his mind to control his food intake and also diet intake. So I just want to say this here, a lot of people would say that why my blood sugar so high, why do I need to eat, still need to have food when our blood sugar is high, right? Sometimes our high glucose in our blood, right? But our stomach is still feel empty, because our insulin receptor is not working. It is not performing at the in a normal condition. So if it's not functional, it continue to come out to the insulin, but the insulin receptor is not working. That is why all this glucose can actually go into our body, and it actually causes our body to crave for more food. Our body thought that we want more and more food, and then our body thought that we are hungry. That is where we keep on reminding ourselves to eat. So here, that is where it is actually create a lot of disorder in our body. So, but I do not want all our friends here, right, do not want to take this as excuse to simply go and eat outside, okay? That's not the excuse, And it could be one of the reasons because your insulin resistant that causes you to causes some of our friends to have the diet control problem. This is my another friend. So he, I also very happy to see him in 2 weeks, right, together with Tian ID and Reset. So in 2 weeks' time, right, the most important thing that you look at him in these 2 weeks, right, because these 2 weeks, he actually hurt his foot. He's not able to exercise in these 2 weeks. In a condition where he does not exercise, his body, right? Her whole body shape changed. You see, all the entire health condition also improved drastically. I am very, very, very happy for him, even though he couldn't exercise at all. So here, I tell you, when the insulin resistant and insulin resistant can function properly, so all our liver, all our entire organ mechanism can utilize the glucose very effectively, and we are able to break fat. We are able to create all the function properly. Our body will become more, body mechanism become much more better, right? So here, and slowly but surely, our body will actually create our shape that we want, and also our energy level can also increase drastically. So of course today we are also very privileged to invite our testimonial sharer, and the one sharer that are coming here, he also come from Kuching. I welcome Jing Chen to do a sharing.
Hello. Good evening, everybody. Firstly, I would want to thank Dr. Joe for inviting me to share this evening. Actually, I'm 32 years old this year. So, a lot of you will think that at such young age, I shouldn't have high blood sugar. But I'm from a family with high blood sugar. So before reset, my blood sugar is like approaching 7, right? But after reset, my blood sugar can reach 5.6. So I'm very happy because of AgeLoc can help me to improve my insulin sensitivity. Let me have a healthy blood sugar level. Other than that, AgeLoc Reset also improve my sleeping condition. I sleep better. When I wake up, I don't feel as tired as before. And when I do exercise, I sweat better, right? So really, you can see on the screen. Before AgeLoc Reset, that day was 6.2. Then through Reset, it was 5.2 now, right? And that is 2 hours after meal. I take that measurement, so 6.2 was empty stomach, fasting. So the 5.2 was 2 hours after meal. That's why I was very surprised. And this is my mother. My mother is a diabetic patient. All along, for more than 10 years, she has been taking medicine. Even if she take medicine, her blood sugar level is still at 9.3 to 12 level. So after reset, within 1 month, her blood sugar level dropped from 5.8 to about 6, and then 5 point something, and 2 days ago I took it's about 4.9 only. Yeah, it's very nice. So really, other than this, her eating habit also improved a lot. Yeah. So she won't keep looking for food. Yeah. So I want to thank AgeLoc Reset, such a wonderful product that can allow me and my family to have a better life, a healthier life. This really, I think, will be a great help to all diabetic patients.
Wow, thank you, Ching Tong. I think it's so young that he also suffering from a diabetic. Just now when I said in our modern lifestyle, this one become actually very normal. And maybe we are still young, but however, if our metabolic it is not function well, it can actually deteriorate. It is actually be damaged on day by day. So here, even though just how he said that even though he said look at him, he's so young. Look at the blood sugar. It's 6.2. It is very abnormal. So he won't feel anything. He won't feel anything abnormal. However, if we continue to do tests like that, you can see 6.2. It is more on the high side at his age. So of course, I'm very happy that he can actually help his mom. Then it's a diabetic patient, and I'm very happy that you can actually help him. And of course, we are also invite our second sharer. We welcome our Miss Sarah Fu.
Hello, hi.
Hello, hi. First of all, I would like to thank Dr. Joe for inviting me to share my testimonial with everyone. Before I started Reset, before I consumed Reset, I was looking forward a lot to take Reset because since young, I have a lot of health issues. I'm 52 this year, and continuously, I actually did a lot of health checkup. But really, all my medical checkup, right, very thankful it's normal. Yeah, and I usually will have a lot of itchiness, and very thankful because I know and I heard that this Reset can actually help. Yeah, and there's doctor who told me before that my symptoms, it's very hard to be cured, and there's no medicine to cure. And when I started consuming Reset, to be honest, right, in the beginning, I always feel hungry, yeah, but I continue to consume it because I am very sure it has started to have effect on my body. I think about 3 weeks, I think my brother asked me actually, hey, how come today, this time around when you came back, yeah, he do this actions, right, to scratch my itchiness, right? Then I said, oh yeah, true. I no longer scratch, right? And I look at my leg again. Yeah, my skin is never nice because I always have itchiness. I keep on scratching, right? And I look at my leg, hey, there's no more. Yeah, no more itchiness, and I don't see my eczema anymore. And I started to look at my fingers, and there's also part on my fingers like what Dr. Joe mentioned just now, right? He showed the testimonials that whenever our finger, we actually use those detergent, right, we will actually have itchiness already. And I went and washed my dishes, and I helped my mom to wash a lot of dishes. Yeah, and I'm very thankful to Reset to help me to recover my skin. Thank you.
Wow, thank you, Sarah. Thank you. Yeah. So you see, just now when I see this, and all this, all his skin, the test on the blood is normal. Why is it we still have all this nitty-gritty problem? This is whereby we say this is we're talking about metabolically unhealthy kind of a syndrome. So of course, really grateful that can help Sarah. And here, yeah, today. And last but not least, this is my last slide. So here I'm also very happy to be able to share this interaction with everyone. I'm also very look forward that I can able to help more people outside there to become much more healthier, and also hope that you that are already in understand all this, and you will become a healthy and metabolically healthy, and help more people outside there to be healthy. So here I will also be grateful and also be admired and amazed with Pharmanex technology. And it is where from beginning that I cooperate with partner with Pharmanex. They are always uplift this philosophy of all of the best, none of the bad. And it's this kind of philosophy to help people outside there to continue to produce life-changing product to everyone out there. So here, I'm very grateful. I'm very extremely glad that we have this partner. We also have a group of dedicated scientists here to come here, continue to produce revolutionary product to help our friends out there. And also, we are also here to our goal is also to be able to help more people outside.
要吗？哦。OK 好 ，OK 好，所以我觉得说真的，我觉得说这群科学家呢，我是非常敬佩，也非常欣赏哦。然后真的，我觉得说其实真的，一路以来哦，我觉得说跟华茂他们这么多年合作呢，哦，真的他们一路来他们都在，他们的目标就是。
I think in
I'm
the
very
way that
grateful that
helping the Pharmanex, all the scientists here, they continue to research and development to come up with best product to help human beings to be much more healthier and much more in a much more quality way of life. And also, I believe preventive is much more better than cure. We are talking about metabolic health here. When we are not talking about, we don't have a major sickness. When we even have a small little illness, we are not aware, because when things are become worse and become chronic, that time will be too late. And I also do not want this kind of thing to happen to us and to the loved one around us. So preventive is always the best cure. So the real preventive is talking about whether other than we take our supplement on time and regularly, and our lifestyle is also important, because when our sleep quality, our diet, our mental health, and also our exercises are also equally as important. If you are able to maintain and upkeep all this lifestyle, I know that everyone can actually live a much more quality and healthier and happier life. Health is always wealth. Now today, I'm very happy. I'm very glad to be able to do a small interaction with everyone. I also hope that everyone should be much more healthier and much younger. And here we become much more youthful, much more vibrant, and go out there and help more people to become healthier and happier. Thank you. My name is Dr. Joe. Thank you, everyone. Pass back to our MC.
Wow, very amazing. Thank you very much to our Dr. Joe for his sharing, and also thanks to both of our testimonial sharers. And really, after listening to their sharings, right, I am very sure we have better understanding about metabolic health now. So health is wealth. No one will reject health. So let's bring this gift to everyone, and every day we must consume our AgeLoc reset. And today our sharing has come to an end. I'm your host for tonight. I'm Delise, and wish you have a beautiful Friday night. See you. Bye-bye.